Hello everyone, welcome to another video. So in today's video we'll be looking at brucellosis. Brucellosis is actually an infectious disease that is caused by a bacteria known as Brucella. So how is it spread? It mainly spreads from animals to humans. So it's a zoonotic disease. You can get it from animals. So it's sometimes called undulant fever or Malta fever or Mediterranean fever because of its pattern of having fever spikes and the geographic association. So this particular infection, it commonly comes from eating unpasteurized dairy products or direct contact with infected animals or inhalation of contaminated particles like dust in slaughterhouses, for example. So it is a public health concern, especially in areas with prevalent like livestock farming. So because of they have a lot of people going into this livestock farming, so they are mostly in contact with animals almost all the time, so it's more prevalent for this particular set of people. So the reticuloendothelial system is a part of the body's defense system, and this reticuloendothelial system is the major target of this Brucella bacteria. So the reticuloendothelial system, what comprises this system? So this system is made up of the liver, the spleen, the bone marrow, and the lymph nodes. So the Brucella bacteria can invade cells, especially the macrophages, which is a type of immune cell in the body. So it can invade cells, the macrophages, and survive inside them. So this makes the infection chronic, and sometimes it can be hard to treat. So how exactly does this infection happen in the body? So looking at the pathophysiology, so the person comes in contact with the Brucella bacteria through ingesting unpasteurized milk or cheese that has not been processed properly, handling infected animals like cows, goats, sheep, pigs, then breathing in infected dust from slaughterhouses. So the bacteria enters the body and is taken up by the macrophages. So inside the macrophages, the Brucella can survive and multiply, traveling through the blood to organs like the spleen, the liver, the lymph nodes, and the bone marrow. So the infection causes granuloma formation, that is small clumps of immune cells trying to fight the bacteria. Then it also causes inflammation and tissue damage. So the body reacts with fever, chills, and sweating, often in a relapsing pattern. So fever comes and goes. So for the causes, for example, drinking raw or unpasteurized dairy products, then eating undercooked meats from infected animals, direct contact with animal fluids, tissues or secretions. So doing maybe milking of the animal, or doing when the animal is giving birth, so direct contact with their fluids, and also slaughtering the animal. So also another cause is like inhalation of contaminated products, like contaminated products in places like laboratories, farms, abattoirs. So these are the main ways that someone can get brucellosis. So for the symptoms of brucellosis, so the symptoms vary depending on the stage of the infection. So the person can have fever, which usually rises in the evening and drops in the morning. So this is known as an undulant pattern. So the fever rises in the evening, drops in the morning, and then there's presence of chills and sweating that can be profuse, and sometimes drenching night sweats can be seen too. So chills and sweating, fever, body aches and joint pains, fatigue, weight loss, headache, having enlarged liver and spleen, which can be felt by the doctor during when the doctor is doing a physical examination on the patient. Then back pain too, if the bones and the joints are affected. So all these symptoms basically circle around this endothelial reticuloendothelial system that the Brucella bacteria actually infects. So in chronic cases, arthritis, spondylitis is inflammation of the spine, and orchitis, which is the inflammation of the testicles, can occur in chronic cases. So other conditions that can look similar to this brucellosis, so we have typhoid fever. Typhoid fever also comes with prolonged fever, but it comes with rose spots and abdominal symptoms too, which is not seen in brucellosis. Then tuberculosis, especially tuberculosis also has similar symptoms, especially when it comes to bones and joints that are affected. Then malaria too. Malaria can cause fever, body aches, hepatitis due to the involvement of the liver. Then rheumatic fever too, which can also cause joint pain and fever. So for the treatment, brucellosis needs specific antibiotics for a long duration, because brucella can hide inside cells. So the usual treatment plan is a combination of doxycycline, which is an antibiotic taken by mouth for about 6 weeks. So a combination of doxycycline with rifampicin. So rifampicin is also taken by mouth for 6 weeks. So these two are effective antibiotics, but from different classes. So in more severe cases or in complications like where there is arthritis or bone infections, streptomycin injections or other antibiotics may be added. And relapses can happen if the treatment is too short, or if the antibiotics are not taken properly. So for the management and the prevention of this condition, try to avoid unpasteurized milk and dairy products. Try to cook meat properly and thoroughly. Then use protective clothing and gloves when handling animals or working in slaughterhouses. Try to vaccinate animals where vaccination for animals is actually available, because it's not available everywhere. Then try to control brucella infection in livestock to prevent the spread to humans. So in summary, what is brucellosis? It is a bacterial infection that spreads from animals to humans, hence it being zoonotic, and it is usually spread through unpasteurized dairy products or contact with infected animals, and it affects organs, like the organs that make up the reticuloendothelial system, like the liver, the spleen, and bones, leading to fever, body aches, joint pain, and fatigue. So the treatment requires long-term antibiotics with a combination of doxycycline and rifampicin that is usually taken for at least 6 weeks. And prevention focuses on maintaining a good hygiene, safe food practices, and also controlling the infection in animals. So that is basically the summation of this condition known as brucellosis. So I'll see you in the next video. Thank you for watching. Bye.